Hi, I'm Baron Metz, a professor of anesthesiology. I'm here to tell you about my book, Waking Up Safer, an anesthesiologist's record of practice. Now, you would know that the average patient does not really fully understand what anesthesia is all about. Most believe that they are going to sleep, where there is nothing further from the truth. In fact, anesthesia induction with agents like this, propofol, or volatile anesthetics shown here, induce a chemically induced coma. It's not sleep. It's not sleep at all. You can't be easily arousable, and you can't protect yourself. So anesthesia is the practice of managing a patient under depths of anesthesia that could potentially kill them. So the anesthesiologist's work is a balance between life and death. Did you know that the average American will experience 6 general anesthetics? Yes, 6 in a lifetime. That's an astonishing number. Yet most are blissfully unaware of the facts of anesthesia. To put this right, I've written the book, Waking Up Safer, specifically to allow the layperson to understand in greater depth what anesthesia is all about, preparing you for the inevitable general anesthetic that will be in your future. Now, anesthesia is inherently dangerous, but as a practice, it has matured into an essentially safe form of medical management. It was not always so, nor in every instance. Things can still go terribly wrong. Before the advent of anesthesia in 1846, very few surgeries were performed. When done at all, operations were limited in scope and often as a last resort, with death as a common outcome. Since then, the evolution of anesthetic practice has allowed increasingly more complex surgery to be performed on ever sicker patients. This anesthesiologist's record tells that story. Drawing on personal experience, as I track a career of 30 years in anesthesia, while tracing historical as well as scientific developments, I chronicle the stories of innumerable individuals that have contributed to its safety. Individuals like Dr. William Morton, Virginia Apgar, and Christian Barnard in the past, as well as Dr. Archie Brain, Atul Gawande, and Mehmet Oz in the present, illustrating the practice of anesthesiology along the way. As an example, let me tell you the story of William Morton, who publicly administered the first anesthetic using a device that looks like this. And he did so at the Massachusetts General Hospital in Boston, pictured over my shoulder in the very nice picture that you see of the institution as it looked at that time. Before doing so there, however, I must actually paint a picture of the horror that surgery was before the advent of anesthetics. More usually, operating rooms for hospitals were situated on the top floor, and there were 2 very good reasons for this. Number one, they needed ambient light, so they had skylights, so that they could actually see their patients while they were doing surgery. But the other thing was that because of the horror and pain of surgeries, the patients would scream and scream and scream. So therefore, they had the ORs at the top of the hospital so that the yells of fright would not emanate down into the rest of the hospital as best as possible. Now, in the surgery of the time, such as John Liston, were prized for their speed. They would sharpen their knife and get everything perfectly ready for the surgery. Then the patient would be brought in, often slightly inebriated by his own account, and then be pinned to the table by 6 stout men. One would grasp him around the chest, 2 would pin down his arm, a further one would hold down his leg as they readied the patient for amputation. An assistant would hold the leg and the surgeon steadied his knife, and then, because everybody was prized for speed, the people in the auditorium would stand up, whip out their pocket watches, and time the surgical event. John Liston was so fast he could do an amputation in 25 seconds. On one occasion, Dr. John Liston, cut straight through the patient's leg, the assistant's arm, and somebody in the audience saw this fright and died on the spot. As a result of this, there was the first episode of 300% mortality for one operation. Now the problem with this was, and the problem that anesthesia addressed, was the lack of need for haste in surgery. And so the advent of anesthesia was much anticipated. So let's turn now to William Morton. William Morton was a man who was always in a hurry, usually a hurry to make money. He was rakish and swashbuckling, and he was wanted in over 3 United States for swindling. Some would have called him a psychopath. History is unclear on how he happened on the idea of using ether as an anesthetic in 1846, but there was a crying need, as I just described, to find a solution to the severe pain of surgery. After trying ether on himself and a few of his friends in a Boston home, Morton was invited to the Massachusetts General Hospital to demonstrate the administration of ether as an anesthetic. Now Morton wanted primacy for the invention of anesthesia, and he had a big problem because sulfuric ether that he had been using had been around for 500 years. Paracelsus invented it. So he needed something more. He needed an apparatus so he could present an invention of general anesthesia. So he turned to Augustus Gold, who was a glassmaker, who fashioned overnight this device that you see over here. The essence of it is that it's a retort, and it has a mouthpiece as well as a sponge. Ether would be put in on the one side, and the patient would inhale through the inhaler. The next day, with the device just finished, Morton presented himself at the Massachusetts General Hospital and administered the first general anesthetic to loud acclaim. The news of that first anesthetic took the world by storm, because of course now surgery could be performed of much greater duration and much greater complexity than ever before. The interdependent fields of surgery and anesthesia advancing in lockstep together as a result of the developments in anesthesia, allowing surgery to progress. However, at the beginning, surgery and anesthesia was still very unsafe. 50% of patients dying. It was always a balance between the life-giving surgery and the potential for death as a result of the anesthetic agents that were administered. The book tells the story of the ever safer practice of anesthesia developed through improved practice in anesthesia techniques, as well as developments in drugs and equipment, ventilators like this one on the side, and to show you how innovative enhancements had added to safety of anesthesia. Let me tell you the story of Dr. Archie Brain. Dr. Archie Brain is always a dapper, well-dressed man with a mischievous glint in his eye. He was born in Japan of English parents and went back to England to study languages and art at Oxford before going into medicine. He had a wonderfully artistic eye. He was drafted to practice anesthetics at the London Hospital, and he put his inventive mind to work as he contrived to create something that was truly would make anesthetic practice safer. Now at the time, Dr. Brain was practicing a lot of dental anesthesia. And in order to give anesthetics for this, one has to maintain anesthesia through the nose using something we call a Goldman mask. So he had a Goldman mask like this, and the anesthetic would be delivered there while the surgeon operated in the mouth. Now Dr. Brain thought this was rather tiresome, that we should hold mask in this way. And so he wondered whether there might be a solution. Now with his artistic mind, he realized that the triangular shape of the nares, as we call it, was very similar to the glottic opening, which is the opening of the larynx that I demonstrate here for you. They're both triangular in shape. So Dr. Brain wondered whether he couldn't place a Goldman mask right here over the larynx, so securing the airway without the need to maintain a mask at the face. Now, more usually at the time, what we would do to secure an airway is we would intubate the patient. So what we mean by intubating the patient is we take an endotracheal tube and place it using a laryngoscope in through the glottis, as you can see right here. So Dr. Brain wondered, could he not marry the two? Could he not take the Goldman mask and attach it in some way to an endotracheal tube to provide a solution to this problem? And so he did. He invented the laryngeal mask airway. And what he did with the laryngeal mask airway, in the essence, he could now develop a device that could be literally placed over the larynx, as you can see here, and secure the airway in a much safer way than just managing a mask anesthetic. So I use stories like this to illustrate how anesthesia practice has become ever safer. Further, I also tap parallels from aviation, including the use of checklists and human factors designs to demonstrate how anesthesia has been literally engineered to become ever safer, not just through equipment and drug design, but also through human factors design. We have made anesthesia the much safer practice it is today. In this book, I promise you that I will not put you to sleep. Rather, I will wake you up. I will wake you up to the magic and mystery of anesthesia and its consequences. My ask of you now is that you go to my website to view some further videos. You can find those at bearingmeds.com. And further, I ask you that you will buy my book, Waking Up Safer, an Anesthesiologist's Record, because it will suitably prepare you for the next anesthetic. As you know now, it is not sleep. It is chemically induced coma. But knowing this, you will be so much better prepared for that inevitable anesthetic. I thank you for your attention.